not just women's health, we're talking about, men's health, fertility, a couple at home, doesn't have to deal with the stress of knowing what's the cause of infertility. And I mean, a lot of them go to self-medication, a lot of them, delay the time that it takes to get to the clinics to get the right answers. And we hope that we can solve for those problems, provide the right answers in a timely manner, in a private and convenient, confidential manner. Right? And these tests are being done in our labs, which are, already servicing clinicians across the country. We have more than 200 plus cities where we do the collections of these samples from. We have more than 4,000 plus clinicians who refer these samples to us. In the same labs where we do these routine testings is where they're also being repurposed to also do these self-collection testing also. And what we do is, once the samples are collected, we also provide the complete comprehensive service. Not only do we test these samples, we can also, like sperm, we can even freeze them down for future use. Today, someone who is not ready to start a family but concerned about future fertility, we can solve for that also by having them frozen for at least 10 plus years. We also provide them consultation with a network of virtual doctors and physical clinics also where we can refer to them for the treatments also. And what we've done is with this integrated approach, hopefully, provided, the ability to do proactive health management, right? So that the health is addressed comprehensively, timely, cost effectively also. And while my colleagues now will share the list of services that are being available in detail, I'll very briefly touch upon the list of services that we have. Right, so sperm score, which is the semen analysis test that we have, sperm vault, which is the freezing of these sperms for up to 10 years of time. We have OVA score, which is the hormone test for women. About at least 11 plus hormones are tested for. Genes, those who have primary infertility. Right? We do a genetic test with at least about 30 to 40 genes which are well established to be the root cause of infertility. At least about 25% of these infertility causes could be because of an inherited genetic condition. So we help provide that diagnosis also. We have the menopause test also, perimenopause. So one can predict, how long will it take to get to menopause, right? So it tells you, are you within the menopause period within 5 years or not, right? It's an FDA approved test that we have. HPV for cervical cancer screening, a swab test that is done right in convenience one's home. Sexual health conditions which are chlamydia, gonorrhea, one of the highest causes of infections in women and many other associated conditions that they deal with. We have the sexually transmitted conditions also, HIV and many other conditions that we screen for. Omega score, this is something where the breast milk is screened for, for the content of DHA, where the children are exclusively breastfed. You want to be sure that the quality of the breast milk is also appropriate. So we provide that test. Genes pass, this is for something not only you want to have a baby, but a healthy baby. So we screen for 2000 plus genes which could be causing an inherited condition, the baby right within the first 2 years of birth. Right? So proactively one screens for it so one can take the right medical advice at the right time. We also have many more launches lined up. Some of the interesting ones are the egg freezing, where post the screening of hormones everything looks good. Women have a little bit more challenging where they have to walk into an IVF clinic, but we provide that network of clinics where we help engage, provide the hand holding, so the collection of the eggs are done, frozen down and then maintained at our labs for long-term preservation. We also have these pharmacological genomic tests, where one can have personalized medicine recommendations also being done. This is for someone who has medications for a lifetime, like in the case of diabetes, cardiovascular, and many other conditions. You want to be sure that the medicine works for you rather than go through a trial and error process. So with the power of genomics, this is possible to make the medicine recommendations. Women's cancer tests, not only HPV cervical cancer, but now you can even screen for breast cancer and ovarian cancer, the most common cancers in women. So even those can be done with the convenience of one's home. With that, I'll take a pause and we'll have Neha come over to explain